If a patient presents with an extremity joint complaint, like a shoulder, hip, or knee complaint, I'm definitely investigating by certain questions, certain baseline taking, and certain repeated movement tests of the spine, whether or not moving the spine changes the extremity joint complaint. But I can also investigate whether or not the spine is influencing the extremity joint by testing the muscles of that extremity and of the contralateral extremity below the level of the complaint. For example, if someone has shoulder complaints, I would expect that not to affect, in the large majority of cases, any muscle strength testing below the shoulder. Elbow flexion and extension should be normal, wrist extension and flexion should be normal, thumb extension and finger abduction and adduction should be normal. If I'm picking up that some of those are weak and or painful, it raises the likelihood that this is not an isolated shoulder complaint and that the problem is more likely coming from the spine. That's because irritated spines, mechanical problems especially, can create not only pain in one extremity, but also weakness in the entire extremity, or distal to the complaint. So that patient who has shoulder complaints, but also has really weak thumb extension and weak wrist extension, I'm starting to think that patient's likelihood of it being a spine disorder is higher. If it's just shoulder complaints and all the muscles below are strong, they're 5 out of 5 without pain, that decreases the likelihood in my case that this is spine and that it is an isolated local shoulder complaint. I mentioned though testing the contralateral sign. If someone has right shoulder complaints and their lower on their right upper extremity is fine in terms of muscle strength, but on the left side they have weak triceps, weak finger abduction, for example, without pain, well, that also increases the likelihood that there's a spinal component. Mind you, of course, the person could have a spinal problem that's creating painless weakness in the upper extremities that is in addition to or separate from their current shoulder complaints. But orthopedic evaluations are about taking all these pieces of the puzzle together and understanding what they can mean. So yes, for isolated shoulder complaints or hip complaints or knee complaints, I'm considering doing testing above at the level of the related spinal joints, but I'm also going to be doing testing below, which helps inform the same question or the same answer to the question, is this a local joint problem or is this a mechanical problem in the spine or another problem in the spine that's creating these extremity joint symptoms? I separate into 3 different categories. 1, a mechanical problem in the joint that can be resolved by moving in 1 or 2 directions in the spine can create mechanical problems in the extremity, and those will present with symptoms. Secondly, you can have referred symptoms from the spine that go directly to the buttock, to the hip, to the thigh, etc. And thirdly, you can have radicular symptoms where there's true nerve root irritation in the spine, for example, in the C5 nerve that's sending symptoms to the shoulder. So we have to take all of these pieces of the puzzle into consideration, and getting the most data we can is really helpful. So not only looking above in terms of thorough testing above the extremity joint complaint, but also taking into account muscle strength, whether it's weak, painful, or both, below the level of the extremity joint complaint can help us gather more robust data to inform our clinical diagnosis.